our function is about protecting and improving the population's health. And within that, we not only work within England, we also work with our other 4 nations, making up our Isle, but also we do international work as well. So part of our whole work is about how we integrate, how we actually link with other organisations to make sure we actually look at that whole 5-year forward view and think about how we make those improvements to population health through a number of different programmes. So within Public Health England we have a Best Start in Life programme board, which is about the early years. It's about bringing in some of the work around maternity, particularly with the recent announcements around improving maternity care. But it doesn't stop there. We also really work on the 5 to 25 agenda as well. So we're really clear about making sure that this is a whole life course approach. And whilst we've got some priorities, we need to make sure that we get the integration right at a national level so that we can support your delivery. So Best Start in Life, I think, is a good place to start, particularly with us focusing very much on early years and health visiting today. So you're very aware of the kind of 4 key pillars that we're focusing on within that, which include maternity, which I've mentioned, Ready to Learn at 2, which is really important and a good sentinel in terms of looking at what the state of the health of our children are at 2. And there are some real key indicators that we need to be thinking about. Ready for School at 5 is really important, making sure that children and young people are ready to learn, not just in terms of actually academic achievement, but looking at their social skills, their emotional health and well-being, and making sure that they're developing good, strong relationships to be able to help them to achieve, both within the school, but also within their families and local communities. And then one of the key pillars, clearly, that you're aware of is obesity, and that creates a huge challenge for us nationally. And in the early years, we actually can put some clear markers down to start thinking about obesity, both in maternity, but also throughout those 4 and 4-year formative years of children and young people. So moving on to technology, I think that's great to actually have that wonderful infographic that says, great, we've got all of these wonderful products that help us to deliver good services, but actually, how do we do it? We need to understand the way families lead their life, and clearly the way that we lead our life evolves, and we need to make sure that we actually can get into that space and understand how families lead their life. And it is quite different. It's quite different than it was 10 years ago, 5 years ago, a year ago. And as professionals, we need to understand that and start thinking about new innovative ways of being able to address the issues. Why the link to technology? Jimmy alluded to some of that. Clearly, a lot of work has been done with adolescents and older young people around technology, because we know that really they are our guiding force. They've actually made us, particularly from a school nurse perspective, to actually need to be much more technical, much more in that digital space. Whether you like it or not, many school nurses will tell you that they've had to adapt very, very quickly because they can't keep up with children and young people. What we need to remember is that these young people are going to be our next generation of mums and dads. And if we don't actually get smart, get into technology, we're going to be left behind as professionals. We're not going to be able to actually have those intelligent contacts if we can't keep up with the pace that they're actually at. So I'm not saying that everything is rosy. Clearly we have to be really mindful about technology and make sure that we use it in the most appropriate way. This is not a replacement for face-to-face contact. We're not suggesting for any minute that technology can actually remove some of those really, really rich conversations that you have with families. But there are opportunities for us to actually really exploit it, so we can really encourage families and support them around empowerment, self-care, about them actually feeling really confident in their parenting. And I think that we need to actually use our professional curiosity to actually think how we can improve both quality and access.